Hi, everyone. Thank you for joining us today for the fifth seminar of Youth Medical Society, also known as YMS. My name is Akash Murali, and I'm the president. And also with me today are our officers who you'll hear from a little later. YMS is focused on providing high school students with an interest in medicine, access to medical professionals. So today we have Dr. Nayak, who attended medical school in Mumbai, India, and did her psychiatry residency at Stanford. She has been working for the last 23 years at Momentum for Health, a nonprofit that provides mental health services in Santa Clara County. There, her work involves working with adults and families experiencing serious mental illnesses and supporting them with medication management, supportive psychotherapy, and linkage to other services. Now, Dr. Nayak will provide us with some introductory remarks followed by a Q&A session. So thank you, Dr. Nayak, for making time to join us today. And if you could please start by telling us a little bit about your childhood, where you grew up, and what experiences made you want to initially pursue a career in medicine.
Okay, can you guys all hear me? Is it good? Sound is good? Yeah, awesome. So my name is Mala Nayak, and like Akash said in my introduction, I grew up in Bombay. So my mother was actually a physician, and she was interestingly the first person in her family, and actually she was the oldest of her siblings, but the only one to go to college. So she was the first of her family to attend college and the only one. And interestingly, she not only went to college, but she also ended up going to medical school. So that was pretty amazing. This is in Bombay, in India, in the late 1940s, early 1950s. As you can imagine, she had several challenges. She had my sister during that time, so she had a young child and had to get through medical school at that time, but she really persevered and finished to become a family physician. So that was, always very inspiring for me. She had after she finished, she raised us as well as um, worked, and so she had her own clinic. She had a small clinic that was about, I don't know, a 10-minute walk from my home, and twice a day, every morning and every evening, she went to her clinic. And she would often take me with her. I was the youngest of three, and I guess my sisters wanted to be at home without their younger sister bothering them. And so my mom would take me to her clinic with her. And, there was, I think, no concept of confidentiality, HIPAA rules, nothing like that in Bombay at that time. And so I was with my mom in the evenings in the clinic when she worked. And I had the opportunity from a very early age to watch my mother work. And I loved it. I loved seeing her do what she did. It sort of really drew me in. She would often have, patients who stopped. It was a very sort of casual clinic, it just drop in. She pulled people from the neighborhood into the clinic to come. It was, for people who had very limited resources, it was a free clinic. So, she often had people stop by to thank her for helping them feel better. There were a lot of people very grateful because she financially supported them through the treatment, right? We used to, in those days, have pharmaceutical representatives who would come to her clinic and give her medications that she could distribute. So if patients couldn't afford the treatment, she would actually leverage that contact that she had and get medications for them. And if she was not able to do that, she would actually fund their treatment herself. So watching all that, I was extremely drawn to that. I was inspired by it. I knew I wanted to do something very similar. And I think those were really my driving forces, as I grew up. thinking about helping people, thinking about healing people, and especially working with people with limited resources. And so that's really what, as I was growing up and I was trying to envision what I wanted to do through my time in high school, that's what I was considering. I was toying around a career in social work. I was toying around a career in occupational medicine because I love to do things with my hands. And I thought that, I could do one of those things, help people in that, or consider a career in medicine. So those were the things that, my driving forces when I was choosing a career. And those were the kinds of things that I was tossing around in my head as I grew up. And I think I finally, settled on a career in medicine. Now, in India, you go to medical school after 12th grade. So, I have to say I didn't have that much opportunity beyond watching my mother really explore medicine. But it seemed like with that, I would really be able to work in areas that I was really interested in and passionate about. So that's what drew me to a career in medicine.
Okay. Thank you a lot for that response. So what we're going to do now is I'm going to invite some of the officers of our club to pose some questions. And if each of you guys could introduce yourself by name and title and proceed to ask your question, that would be amazing. So let's go ahead and start with the first person.
Hi, Dr. Nayak. My name is Akarsh, and I'm the website director here. And my question is, are there any experiences going through training or med school or throughout your career that stood out as key learning moments?
Um, that's interesting because so I went to medical school in India, and then I actually did a residency there in India in ophthalmology. I was actually toying between a career in psychiatry and ophthalmology, but at that time I had no idea that I was going to come here. And so I thought that there's a lot of stigma to psychiatry and mental illness in India, and ophthalmology seemed like a good choice at that time for me. So I did that, but then I came here, and then I don't know if you know, but if you come here from another country, you have to do a whole bunch of exams. And then you have to redo your residency. So I had this opportunity to redo my residency, and I thought I would pursue it in what I was really had been interested in from the beginning, which is in psychiatry. And I would say every day through my training and today is a learning experience. It's very hard to say that there is a specific moment or a specific day. You learn every day from your patients. You learn every day from your co-workers or your peers. During my residency at Stanford, I learned a lot from my co-workers, and we continue to have meetings at work with the entire medical staff. So I learn a lot from them. Our clinic has a lot of support staff, case managers who are social workers who work with our patients, vocational services. So I learn a lot from them. So it's hard to say what was a key learning moment. I would say that every day you learn, and from everyone around you.
Thank you.
Mm-hmm.
Hi, Dr. Nayak. My name is Rahul. I'm the VP of YMS. My question to you was, can you tell us about the impact COVID-19 has had on your work? How has it impacted your work with patients, and what are the major setbacks you faced?
So that's an interesting question, Rahul. So, we've obviously switched with COVID to working from home, and I continue to actually work from home, and that's if more than a year before this, you had asked me, can you do this work from sitting at home? I would have said, there's just no way, right? That how can you practice psychiatry sitting at home? Because there is so much that is communicated in like, being in the same room with the person, right? There is so much outside of what the person says, the vibe in the room, your interpersonal dynamics, what you pick up in nonverbal communication, all that. So I would have really been like, there's just no way. But I have to say that it's been a pretty good transition. I think I have to thank a number of things, but modern technology for one. It's made it easy, right? Between the phone and Zoom, there are ways to connect with people. So that has been good. The other advantage that I think that I personally have is that I have so I've been at the agency for a long time. I've been at the agency for 23 years, and I've had some patients with me for 23 years. I've worked with them for so long that I know them really well. And so it's okay to talk to them on the phone. That whole nonverbal communication vibe, all that, I have a good sense of that with them on the phone as well as on Zoom. And so in that way, it has actually been okay, right? In terms of challenges specifically, I would say that, again, I don't know if you got a sense for the kind of work I do from what I said earlier, but I work for an agency called Momentum for Health, and we contract with Santa Clara County. So that's the county that I live in. And we manage the psychiatric care of the chronically mentally ill that live in the county. So these are people with long-standing mental illness, right? And a lot of them have very poor resources. So they are all people who are, don't have private insurance, are not able to go to the Stanfords and the Kaisers and the El Camino hospitals and all that, right? So they are they are chronically mentally ill, and they are so disabled by their mental illness that as a result of that, they have state disability or Medi-Cal. And so some of them are homeless, some of them are substance users. And so they all, they don't have video, they don't have Wi-Fi, they don't have connectivity. Some of them are on the streets when they're trying to talk to me on the phone. So that part has been challenging, right? Trying to talk to somebody, you're doing a psychiatric appointment which needs privacy, and you need the person to be alone, but they're out on the street with buses and cars and traffic going by. So that is definitely been a challenge. It's also been a challenge that the pandemic has gone on for so long, a year. Can you imagine if you already have anxiety and you're in this uncertain situation for more than a year? So that has been a challenge for a lot of people. Initially they were okay, but as time has gone on, they have definitely become more anxious. So I would say those have been some of the challenges that we've had. On the positive side, as I said, it's worked out okay for the most part, other than the challenging situations that I talked about. It has worked out. It's also actually, like I was saying, I know the patients really well, so that's okay. But it's challenging with a new patient. It's somebody I don't know. Every once in a while, I have a new patient. And doing that for the first time on the phone or on Zoom is not a great situation, because again, it's hard to pick up all those other forms of communication that we get when we're in the room with the same people. And a lot of my patients are really isolated because of their mental illness. They've been sort of shunned by society, shunned by some of their families. They're really alone. And so they really, it's like an outing, right, to come to see us. And then our clinic runs group therapy, and they have a lot of support, and all that is currently missing for them, right? So that has been another challenge, that it has increased the isolation. On the other hand, I will add that there's been, especially at the start of the pandemic, because my patients are so isolated, so many of them were actually so happy. They are like, whoa, now the rest of the world knows exactly how we live, right? This is our life. And none of you had any sense of what it's like, and now you all know. So yeah, does that answer your question, Rahul?
Yeah, I did. Thank you.
Mm-hmm.
Hi, Dr. Nayak. My name is Adrian, and I'm the secretary of the club. And I was wondering if you could tell us a little bit about your typical day right now, and like, what are the more enjoyable parts about your work and some of the less enjoyable parts?
Yeah, sure. So my day is obviously a little bit different right now because of the pandemic, and I'm working from home. But generally, I would go to work and I have a day full of patients. At Momentum, I get to see both new patients as well as patients that as I said, I've known for a long time. My new appointments, I see each patient for about an hour and a half to do a complete assessment. And then my follow-up patients are all for about a half hour. So and my work, so in psychiatry there is the aspect of medication, right? We have a medical degree, so I'm able to offer my patients medication management as well as supportive psychotherapy, right? So at the clinic that I work for, the psychiatrists are mainly involved with medication management. So my appointments are usually, the first half at least, are just checking in with them regarding their medications. Are they taking their medications? Are they having any side effects? What are the symptoms that are not being treated? Regular, like going to see your doctor and checking in for medications. But the other part of it is also that that's for me the part of psychiatry that I like so much, is that it's the one field in medicine where the relationship with the patient also means a lot, right? So I try to spend, once the medication check-in is done, I try to spend the rest of the time talking to them about their lives. Is there other ways that we can support them, helping them understand how they can move forward? I, like, every day with every patient, I have the same sort of mantra, that what is the biggest small step you can take, right? Patients are isolated, they don't have social lives, they don't have social skills. So again, teaching them small skills, like, let's every time make some goal so that when you come in next time, you're one step further ahead. So helping them with that. Our clinic, as I said, has a number of other services as well. We have therapists, we have vocational services, we have groups. So referring the patients to those other services, depending on where they are and what seems appropriate for them. So that's basically what my day is like. I love seeing my patients getting better. That is, of course, the most satisfying, to see them from being symptomatic and not being able to function at all, to watching as slowly their symptoms decrease and them increasing their activity levels, to then, when they are actually ready, I start bringing up, do you feel ready to start volunteering? And then finally the big step, which is considering a transition back to, or in some cases for the first time ever, into the workforce, right? That doesn't happen with everyone. A lot of our patients are very chronically ill. They would have been, in the good old days, institutionalized, but there are a bunch of people that we do get back to work. So that's been really great. As I said, I really enjoy working in a team. The kind of people I work with, the patients, it would be very difficult to have a private practice with them. But we're able to do that because every patient that comes into our clinic gets a case manager, a social worker who helps them and supports them. And then we have all those other services to support us as well. So I think one part of your question also was, what do I not like? What is the least enjoyable part of my day? And I think for me, the least enjoyable part is dealing with insurance companies, right? So we don't have, like I said, my patients don't have private insurance, but they do have state disability. And that is what pays for their services, and they want to minimize what they're paying for their services, right? So they have certain medications on their formulary. They want us to only prescribe those medications. Sometimes, the patient needs another medication. We need to justify it. So that whole part of dealing with insurance companies is not my favorite part of the job. But outside of that, I love what I do.
Thank you.
Sure.
Hello, Dr. Nayak. My name is Archie, and I'm the treasurer. My question is, what have been the critical milestones in your career, and are there things that you still want to achieve?
So that's a hard one for me, right? I've been working at the clinic for a long time, and it's really worked out for me. So I'm continuing. So I'm sort of hoping to continue to do the same. I would, so I don't have that I want to become the medical director of the clinic, or I don't have some sort of different sort of lofty career ambition. I just want to continue doing what I'm doing. I would love if every one of my patients got better. That would be a great ambition for me, that if all my patients got better and they were all able to return to a higher level of functioning, and all of them were able to go back to work, that to me would be a wonderful, very gratifying milestone. But for me personally, I don't have a sort of personal career milestone that I'm trying to get to.
All right, thank you.
Mm-hmm.
Hi, my name is Tumin, and I'm one of the publicity directors here at YMS. And I have a couple questions for you, so feel free to ask me to repeat myself. But my first question is, what are some of the most complex mental illnesses you have worked with? And what are the major breakthroughs that you've seen in the field that you're looking forward to?
Yeah, so at our agency, we see people with, like I said, chronically mentally ill. So a lot of patients with schizophrenia and other psychotic illnesses, mood disorders, especially bipolar disorder, severe bipolar disorder, some depression, some anxiety disorders, like obsessive compulsive disorder, panic, agoraphobia, post-traumatic stress. Often our clients or our patients have multiple diagnoses, right? So I sort of named, but you could have a patient who has 2 or 3 of these conditions, right? So and then they may have other things like developmental disabilities, learning disorders, medical conditions, other things, old age, substance use. And then a lot of our patients have social challenges as well, right? Like I said, they may be homeless. Or as a result of the mental illness, they have very little social or family support, right? Or on their own, just because of their mental illness, they have really carved out a lifestyle of isolation and withdrawal. So in addition to treating symptoms, our work really focuses on helping our patients reintegrate into society, right? So that's the crux of the work that we do. And so in terms of breakthroughs in the field, there's just so many ways to take this, right? There are just so many ways that would be so exciting, and it just really depends on where one's interest lies in terms of where you want to focus your interest, right? There's a lot of studies that compare what I described, like medication management and therapy, right? So you could see breakthroughs in that, right? Developing therapies that are more and more effective, more targeted at specific conditions, right? Helping patients see the link to what their symptoms are and how that links up to maybe past experiences, and also ways to go forward with that, right? Like I always say, it doesn't help for me to know that I have this symptom because of this childhood trauma unless I understand how to take it forward, right? So what am I going to do about it? How am I going to process that? And how am I going to go forward? So there's that whole, as I said, psychotherapy aspect and the comparison of that with psychiatry. But within the field of psychiatric medicine, there are also just so many possible breakthroughs, right? All the medications that we prescribe have, so if you were interested in sort of pure pharmacology, the medications that we have all have side effects, right? So question would be to look at, can we, the medications cause weight gain, they can cause people to get diabetic, they can cause people's blood pressure to go up, cholesterol to go up, sometimes thyroid dysfunction, sometimes so wouldn't it be nice to develop medications that don't have these side effects, right? That would not. So developing new and they're always trying, right? New medications are always coming onto the market and supposedly with fewer side effects, but we don't always see that. So wouldn't it be nice to have that? The other thing is that, in schizophrenia, you have what we call positive symptoms, right? Which are, the patients hear voices, they have paranoia, they have delusions, but they also have what we call negative symptoms, right? They have a lot of apathy. They just don't want to do anything. They don't enjoy anything. They're just isolated. They're withdrawn. And the medications are great with helping with those positive symptoms, but the medications don't really help with the negative symptoms, right? So all those voices and stuff, you can go make them go away, but you can't get them to get moving, go outside, do something, right? So wouldn't it be great to develop a medication that helped with the negative symptoms as well? And then there is so much, like I said, it would just really depend. I mean, there are so many breakthroughs, right? Understanding genetics, understanding what is the method of transmission of schizophrenia, right? We could then pick up early diagnosis. If you knew that somebody had an aunt or an uncle who had mental illness and you had a way to genetically track that and know that someone is on that path, maybe you could have early intervention strategies so that this person doesn't develop a mental illness. And what would wouldn't it be a breakthrough to know what those early interventions would look like? Surely you're not going to medicate someone who's asymptomatic, but surely it would be wonderful to be able to early on identify who it is at risk and what can you do to help them, right? There's a lot of research and hoping for breakthroughs in actually understanding at the level of the brain what is going on in these illnesses, right? So that in neuro, so if you had an interest in psychiatry, but like I said, you could have an interest in psychiatry and genetics and you could track that. If you had an interest in psychiatry and neuroradiology, right, you could look at PET scans, MRI scans, images of the brain to understand what it is that's going on at that level. If you were interested in sort of molecular, at a molecular level, understanding at the receptor level, what's going on in these we know these medications work, we have some idea of the neurotransmitters, but again, at a cellular level, what is taking place in the illnesses and in the treatment, right? So there are just within psychiatry, just so many possibilities of breakthrough and so many possibilities of pursuing further research, right? There are so many, like if you say depression, I can tell you, 10 different medications or more that we use in the treatment of depression. But the thing is that each medication has only about 70% efficacy, right? So that means if you give it to 100 people, only 70 of them will respond. One, I would love 100% efficacy, right? Wouldn't that be great? But I would also like a way to know which are the 7 people that are going to respond to this medicine, so I don't waste time. Otherwise, I put somebody through a trial, it doesn't work, and then I try another medication, right? So I've wasted so much time. So if I could have a breakthrough in which I could know who's going to respond to which medication, that would help a lot as well. So lots of areas of possible research and breakthroughs.
Thank you.
Mm-hmm.
Hi, Miss Nayak. My name is Ashley, and I'm the publicity director here at YMS. And my question for you is, have you faced any surprises that change your perception in this field?
Surprises. I don't believe that anything, well, I don't know, that in some ways that's hard, in the sense that it's what is not surprise, like I don't feel like in my career something has happened that has completely surprised or changed my way of thinking about it. But at the end of the day, psychiatry or all of medicine really is dealing with people, right? And so people are unpredictable, right? There are surprises for me every single day when I go to work, right? Nobody responds to the everybody doesn't respond to the medications the way I expect them to. People don't follow through and do the things that I imagine them to do. So yes, there are surprises every day, but has there been a surprise in terms of what I envisioned my life and my practice to be like? No. Does that, I don't know actually if that answers your question.
Yeah, I think it answered it. And then just like a follow-up question, but you kind of already answered it as well, is has your career been exactly as you expected it to be?
So that's what I was saying, that yes, this is what I had envisioned. Remember what I said is that I had this vision of helping, healing, and working with people with limited resources. And the path I have chosen within psychiatry has really given me the opportunity to do all those things. So yes, in that way, it has been what I expected it to be.
Okay, thank you.
Mm-hmm.
Okay, so thank you for answering the questions from our officers. So what we're gonna do now is open it up to a member Q&A. But before we do that, I have a question of my own, and that is, are there any suggestions or pieces of advice that you can offer those that plan to pursue a career in medicine, or any specific remarks you can offer to those that might be interested in your field?
Yeah, I mean, I would say that it's a wonderful path, and I really encourage all of you to consider it. There are probably very few career options that are as satisfying, as gratifying as having an opportunity to help other people and changing the trajectory of their lives, right? What could possibly be better than that? And I think having a background in medicine also really helps with your own medical issues and your families and friends medical issues as well. That has been a huge benefit, I think, of having someone in the family studying medicine. I watched my mother do that. I watched her support our family and friends, through the years with their medical problems. And it was just so, for me it was inspiring, but also I feel like you can really have an impact with people that directing their medical care and directing their treatment and helping them with that. So but medicine is a long and challenging road, and so for all of you that are interested, I would say that think about it before you dive in. I know shadowing physicians is hard because of confidentiality and HIPAA requirements, but do what y'all are doing. Talk to as many people as you can, so you get a sense of both what a career in medicine looks like and what the alternatives are, and within medicine, what your options are, right? And I don't know if there are people who are in this group that are specifically interested in psychiatry, but I just wanted to say that I sort of presented just one path within psychiatry. There are so many other paths, right? You could do inpatient work in psychiatry. You could do, chose not to go further, right? I just did a general adult psychiatry residency, which was an internship and then 3 additional years. So 4 years after medical school, but you can do a fellowship after that. So you can specialize in any areas such as child psychiatry or substance use or geriatrics or specific illnesses like in schizophrenia or an obsessive compulsive disorder. So you could do that. You could also work in a county clinic like me, but you could have a private practice. You could work in an academic institution. You could do research, and your decision will be based both on your interests as well as the sort of phase of life you're in, right? As I've told you guys, my interests were those 3 things: helping, healing, and working with people with low resources. And so I chose this path. I also chose this path when the sort of time came when I finished my residency, because at that time I had my older daughter, and then within 2 years I had my second daughter. And so for me, it was really nice to be able to work in a clinic where I was super busy when I was there, but I was done when I was done, right? If you have a private practice, you need to be available to your patients 24/7. And I didn't want that. I wanted to be involved in my daughter's lives. And so I always wanted to be home when my kids came home from school. And so I was able to find this job that gave me the opportunity to do that as well. So there are so many options, within psychiatry as well, in terms of work environments, fields of psychiatry. I picked one, but there are so many there. And I'm sure all of you will, in whatever area you choose, whether it's medicine and within medicine, psychiatry, or otherwise, you'll find the path that makes the most sense for your interests as well as the phase of life that you're in.
Okay. Thank you for that answer. And like kind of as a follow-up, so you mentioned how it was a gratifying experience. So is there really a specific experience that you have that was most rewarding to you, or like a specific case maybe?
I mean, so many. It's just, again, this whole thing of when someone comes to you really sick and not able to function, right? They've given up their lives essentially. They cannot work. Say in the case of a schizophrenic patient, because they are hearing voices all the time, they are paranoid, they feel like people are doing things to them, they can't leave their house, they can't do anything, right? And then you start working with them, and slowly you work on initially the reduction of the symptoms, like I said. And then once the, voices are gone, and then the, delusions are gone that they don't believe people are doing things to them, then they start looking at volunteer work. The person I'm thinking of, he started then doing volunteer work with the local fire department, and then has now actually got a job for 20 hours a week. So to see that transition, right, to support someone through that is just enormous. And looking at them and their desire to then want to move to working full time, getting benefits, getting health insurance, so they can feel like they are productive members of society again. I mean, so many things that all of us take for granted, that this is going to be the trajectory of our lives. And then this mental illness strikes somebody and completely derails them. But watching them grapple with that, the intensity of that, and then trying to get back on track is just enormous.
Okay, thank you. So what we're gonna do now is open it up to a member Q&A. Now, for people that have a question, go ahead and raise your hand, and I'll pick on you so you guys can go ahead and ask her. Yeah, Yubin.
Yeah, Miss Nayak, I have a question which is like only hypothetical, but like let's say that your friend or family member is showing signs of depression, and how would you approach them about this difficult topic without making it weird or uncomfortable?
Well, you start by just talking to them about what's going on for them, right? And then you can start, see how they respond to that. Are they open? Sometimes people who are depressed really want help, but they don't know how to ask for it, right? They don't know how the other people will feel about it. They don't know whether you're going to accept it or be overwhelmed by it, right? So really, I would start by sort of providing an environment for the other person to open up to you in, right? And then taking it from there, seeing how the person responds to that. Because very, very often the person is relieved that someone else has noticed, someone else is there for them. They really need to know that. And when you have depression, everything is sort of, you have negative thinking, right? Negative thoughts. So it doesn't feel like people care for you. It doesn't feel like what is important to you is important to anyone else. And so it's then hard in that situation to really open up to anyone, right? So really, and not just like one time, but multiple times, providing a safe environment for them to talk and open up and express what's going on for them is extremely important. And then if they continue to if they do respond to that, then you can obviously take it from there, point them to resources for getting help. And if not, you start bringing in other people as well who are able to say, look, hey, we've noticed some changes in you. What's going on? We really, again, letting them know that you're there and you can help is the best thing you can do. Does that answer your question, Yubin?
Yes, thank you.
Yeah, Arya.
Is there like any treatment or anything that would like get rid of like schizophrenic symptoms like completely out of a person?
So yes and no. so there's a whole spectrum, right? There's a whole range. So, what would be wonderful is if if all the person's symptoms were gone and they were just back to 100%, right? And that does happen, for some people. Again, remember I said there are so many ways to study this illness and so many things that could be done for reasons that we don't understand. Sometimes people do have just one psychotic episode and then they are okay. Some extreme stress or lack of sleep, something triggers it. And so at one end there are people who respond beautifully, are able to get back 100%. Maybe they need to take their medications, but they really function well. We saw those patients when I trained at Stanford, right? These are high-powered executives. You wouldn't even know that they have a mental illness. They are taking their medications, they are functioning well, and they're doing what they need to in their professional lives. And at the other end of the spectrum are people who have been through so many medication trials, nothing happened, they don't respond, in and out of hospitals, mental institutions, all that, right? So that's the other end. There are very few people at both ends. Most people are in the curve in the middle, right? People who respond somewhat, right? And then the question always we have when you work in psychiatry is that how do you work with those people, right? What do you do? Like, I can keep pushing the medications up on somebody, but they're going to have side effects. So if I keep treating someone till their symptoms are gone, I might be able to get them to that point, but they'll have side effects, right? And I can't do that. So at what point do I decide that, weigh the risk benefit ratio and decide that this is the point at which I'm going to stop, right? So that needs clinical judgment, that needs experience. You work with people, you understand where it is that you want to stop. And then, you have to, again, that's why you have monthly check-ins with your patients to see whether that point that you've decided is okay or not. And then at the end of the day, a lot of mental illness is like diabetes, right? That once you have the diagnosis, you need to be taking your medication your whole life. If you have hypertension or you have diabetes, you take your medication, right? And so the illness is not gone, but it's controlled because you have the medication, right? So it's not like surgery where you can surgically excise it and take it away, but you can treat it. Does that make sense, Arya?
Yes, thank you.
If anyone else has any other questions, raise your hand. Yeah, Mr. Chow.
I'm just curious here because, thank you for coming out. This is great. Students really appreciate this. I just want to ask, and this is just for my own curiosity, in your field, I mean, it's very different than, say, like orthopedics, right? Because you take an X-ray, you look, and okay, I know here's the problem, right? In your field, a lot of times, like you were saying, some drugs don't have has certain efficacy and they don't fall within that group. Then you have to try a different medication or third or fourth or whatever. Maybe none of them work. So then, in cases like that, would you need to consider like using imaging data like PET scans or maybe MRIs?
Yeah, that's why I was saying that would be so great if we had that, when we were talking about areas of possible research, that's exactly what I was saying. That wouldn't that be great that if we were able to correlate that with that, if you saw a particular kind of neuroimage, that these are the patients who respond to this. And if you see another, the science is just not advanced as much right now, but that would be wonderful. If one of these young people could do that, I would be so, so grateful.
Thank you. Yeah, that was my question. Just, the usefulness of imaging. Is it useful now, though? Are you using imaging data in current treatments or diagnoses?
Only in research kind of situations, not in clinical. We do for anybody who's presents for the first time with symptoms, right? We send them for all kinds of testing, right? The person that you were talking about for an example, and I talked about the young man who was completely devastated by his mental illness and then has, started volunteering and gone back to work. So when he first came to me a year ago, we before you give someone a psychiatric diagnosis, you want to make sure you've ruled out all medical conditions, right, that could be causing it. So we did a complete investigation of all kinds of, from a spinal tap to neuroimaging to PET scan, MRI, blood tests, ophthalmological exam, to make sure that we were not missing any medical condition that could be treated and as a cause of his symptoms, right? And every new patient with psychotic symptoms really deserves that first, because wouldn't you want that? Wouldn't you want that for your child if they had, So everybody for the first time gets like somebody said, the $50,000 workup. They need that. But after that, once you've ruled out everything else. So yes, it's used initially to rule out other things. And it's used, they're trying in research settings to try to find correlations, trying to find ways to identify people early with, in their PET scans, and how the glucose is taken up in the brain, to be able to identify these people early. So like I said, and then figure out what would be the early intervention in these people so that they don't develop a full-blown psychotic episode.
If there are any other questions, feel free to raise your hand before we close out. Okay, so it doesn't look like there's any other questions, so we can go ahead and end things off. So I would just like to thank everyone for joining us today. Most importantly, thank you, Dr. Nayak, for making time in your busy schedule to talk to us about your career as a psychiatrist. Our membership was particularly interested in your area of expertise, and we are really honored to hear from you and benefit from your experiences. Now, your career trajectory working in psychiatry shows a unique perspective in the medical field, and I know you have inspired many of us to learn more. And as well as this, I would like to express my appreciation for Mr. Chow, who is continuing to support us on multiple fronts after launching this club. That's it for now, everyone, and see you at the next club meeting. Thank you.